Good evening. I'm Barkha Dutt. You're with the Mojo Story, our independent digital platform that does a deep analysis of one big story every day. Today, of course, we're talking about what else? India's second COVID wave and what the data actually tells us. We're also going to ask whether it is productive anymore to keep looking at the number of people testing positive. What does that really tell us? Should we not be looking instead at fatalities, recoveries, as well as vaccinations, amid reports that vaccines are in fact running short in some of the smaller centers and smaller towns? That's going to be our big conversation today with two of the foremost experts in the country. But first, let's take a look at how the numbers stack up at this point. India has recorded its biggest single day rise in the number of cases in the last 24 hours. If we take a look at how those numbers actually stack up, we are seeing more than a lakh of cases, and we're also seeing 630 deaths that have been reported in the last 24 hours. So this is the second time in 3 days that we have breached that 1 lakh figure. India is now the third worst hit countries in terms of the cases in the world after the United States of America and Brazil. And remember, this is in terms of the cases, not in terms of the fatalities. So we have to keep distinguishing and talking about which part of the data we're reading. It's also important to talk about the number of people who recover. 59,856 people have been discharged from hospitals in the last 24 hours alone, and the recovery rate stands at nearly 93%. So the big picture, of course, is that second time in 3 days that we are breaching that 1 lakh figure in terms of how many people have tested positive. But we do also need to look at the number of vaccinations. And before I introduce our guests on the program today, I want to briefly look at where we stand on the vaccinations. We are, in fact, one of the fastest vaccinating countries in the world in terms of absolute numbers. Can we please pull up the vaccination graphic? We have now more than 87 million vaccination doses that have already been completed. But remember that while this places us in absolute numbers in a pretty good position when we compare the speed at which we're achieving these absolute numbers, and this is the number of vaccination doses in the last 24 hours, this is not enough for a country that is as big as India, and we are getting reports of vaccine shortages in several centers, even as the center continues to keep a tight grip on who gets the vaccine, which state gets how many vaccines. Maharashtra, remember, is asking for all above 25 years of age to be allowed vaccination, and the center is saying no. At the moment, a little over 6% of India is vaccinated. Now, we cannot actually go into a national lockdown. That was one of the mistakes of 2020, maybe inevitable in the beginning, but then we prolonged it too long, and yet we're seeing Maharashtra and Delhi impose restrictions. Let me introduce our experts on the program today. We're joined on the program by Dr. Jayaprakash Muliyil, one of the country's most respected epidemiologists. Welcome to the program, sir. And we're also joined by Dr. Shashank Joshi, who's a member of the Maharashtra COVID Task Force and has been at the front lines. And Maharashtra now, of course, almost 60% of the new cases continue to come from Maharashtra, begging the question as to why Maharashtra should not get more vaccines than some of the other states. But first, I'll ask Dr. Muliyil, who's never been a fan of lockdowns, to actually look at the big picture. Dr. Muliyil, I know in all our conversations, you've argued that the actual number of people who may have been asymptomatically COVID positive, we don't even know. That number could be, I think the last time you said 30, 40 times higher. But the question still remains, we're looking at the language of lockdowns again. How does this make you feel in terms of the big picture?
Everything we do should have a clear objective. If you lock down and make people stay inside the houses, all 136 crores, and keep them inside the house for a month, I'm sure the cases will come down. But that will be a dumb way to do things. Now, the important thing to remember is are we in any danger? Now, when we spoke earlier, there was an anxiety. A large number of people will die. The whole nature of the COVID disease has changed. We knew there was a large number of subclinical. We also knew there was a large number of hidden cases which we don't see. But we also didn't know India was going to experience such low death rate. So that is the point of view I'm going to hold on to, because in the initial phase, when at about 96,000 cases per day, cases started falling, and there's a tantalizing fall. One of the obvious problems was that we had not reached the zero positivity we anticipated, but still the fall continued for almost 3 months. Now, what has happened to people who have been guarding themselves, being seronegative, being very COVID conscious? I think there is a relaxation which we all talk about. Now, should we panic? This is the question. Remember, whatever the reason for this is, there are some people who believe there are variants that is causing the problem. I am not sure about it. But one thing is sure, our behavior has changed in everywhere. There's less anxiety about the disease. I
But
remember I
now
was
we are back to the same anxiety, Dr. Muliyil. You may be right, but now we are back to the same anxiety. We are saying states like Maharashtra, cities like Delhi impose night curfew and restrictions. I want you to elaborate on this statement that you just made. You said locking people in for, let's say, a month or a few weeks is a dumb way to do things. Can you elaborate on this? I personally think lockdowns are not sustainable. They were only meant for the health system. But we are once again getting the same reports, beds running short, vaccines running short. And that is why governments impose lockdowns. That's what they would say.
India loses almost 10 million people every year due to various illnesses and death. They need hospital care. The last year, the number of people who died of COVID alone is only about 160,000. Now, we should remember there are other pressing priorities in India. The way we view the disease is probably wrong. We keep counting virus positive. There are a whole lot of diseases where virus become positive. It doesn't touch the human being. It is not something that contaminates you for the rest of your life. Remember, natural infection also gives you very long-lasting immunity. Given that context, people infected is not a public health problem. People falling sick and dying, that is a public health problem. And if you differentiate these two factors, then they're not anxiety. What we need is, we are doing it correct. We are being cautious, but the behavior of the people, for various reasons, election, festival, they have relaxed. And what I said, I want to repeat. Most people have now learned about COVID, and youngsters know even if you get COVID, you'll be kind of indisposed for a little while, but that is not going to make a big difference. It is the disease that affects seriously the senior citizen. So go ahead.
While I tend to agree with a lot of what you're saying, when you try and say this to someone who knows someone who's COVID positive, they will say you're being insensitive, you're being callous, you can't imagine the fear that we're feeling at this point. Would you be totally anti-lockdown, or would you favor short lockdowns? Would you favor short, limited lockdowns, finite lockdowns, Dr. Muliyil?
I think in a management of this kind of situation, our ability to cope is to be decided by local administrators. And they may choose strategy to do it. The last time what we did it all wrong. We practically imprisoned population, couldn't respond to their health needs, their daily need. Now that word should go away from our lexicon. We may have control measures, restrictions. These are all advised to the people. Remember, we live in a democracy. And this particular approach of advising, educating, getting people's participation will have a greater success than some sort of a lockdown and police action. So I'm very clear in my mind the word lockdown is probably absolutely wrong. Restrictions on movement, all through people's participation, would be the right approach. India is a complex country. Whatever you say about one part may not be correct for another part. So I don't want to write a
Sure.
book how to manage.
Okay,
But
let me try and get a maybe a counter perspective from Dr. Joshi, because he's with the task force in Maharashtra, which has chosen a partial lockdown approach, which is a complete weekend lockdown, a night curfew, and of course even restrictions on deliveries after 8 p.m. Dr. Joshi, I want to understand from you. You heard very strongly from Dr. Jayaprakash Muliyil why he thinks it's a bad idea. I would just add one statement to that. I think the lockdown punishes the poorest people and it actually offers no succor against the virus. That's the first point. The second thing is we now know better from last year how to treat this. And Dr. Mulyan is right. Most healthy people will recover. So instead of creating this absolute fear around the numbers of those testing positive, do we not need a different approach? Why did Maharashtra and why did the task force feel the need for this partial lockdown?
So you can separate a task force from Maharashtra. A couple of things we need to understand very clearly. The first thing we need to understand is that Indians are unique all over India. Each geography has different challenges. We found that people were reckless, they were careless, and they were simply not willing to accept. They were in a rebellious mood and not willing to accept any COVID appropriate or COVID appropriate protocols and COVID appropriate behavior. Neither were they masking, nor were they behaving appropriately. They were crowding, they were into poorly ventilated spaces. And I think that's something which we need to recognize. Now, I agree with you that, and I agree with Dr. Muliyil, the best way is to ensure that we seek their cooperation, make them responsible for their own health, and solicit their cooperation. What has happened in Maharashtra is in the last 6 weeks, we have been swamped by an explosion and a tsunami of cases which are growing every day at a geometric progression, not at an arithmetic progression. And that has overwhelmed the healthcare infrastructure here. And that probably led to the government, in their wisdom, to apply some degree of restrictions in those hotspots where the test positivity rate somewhere has gone beyond 25 to 50%. If 25 to 50% of your population is going to get overwhelmed, they probably felt a restrictive approach may be beneficial, because despite of having a TPR which is very high, people were still crowding into restaurants, into malls, and life was behaving as if it was normal. So I think the whole philosophy that, COVID is gone and there is a vaccine around, there are treatments around, the case fatality rate is very low, actually became counterproductive. And people became more and more rebellious. See, as human beings, we tend to rebel. And I think that is something which has hit Maharashtra very hard. And I think that is why now our infrastructure has been starting to crack up now. And definitely the other problem which occurred, which Dr. Muliyil very rightly pointed out, that the exposure pattern changed. Initially, it was the poor and downtrodden, like the slum areas of Mumbai, like Dharavi, which yourself you have traveled, Barkha, they were affected. Now they are almost 50-60% seropositive. While it is the middle class and the neo-rich class living in the high rises, which are now swamped. And this current strain is faster transmitting, but with a lower virulence, but is affecting families to families. And people who are with comorbidities obviously will get afflicted. So though our case fatality rate is looking low, if this continues at that geometric and exponential rise, obviously it is going to strain our healthcare infrastructure, and which is why some restrictions have been there. It is like a chain breaking strategy for a few weeks. In fact, what we had recommended is a circuit breaker strategy, maybe for a couple of days, so that we could recycle it. But most scientists feel that at least a 14-day restrictive strategy will help us to at least dent the curve. See, there will be the first wave, there has been the second wave, there will also be a third wave. But we need to keep our healthcare infrastructure ready for that. Currently, we are under a strain. We don't have beds. Currently, this particular virus is having a little milder disease compared to the older virus. But there has been a shift. First shift is that a younger population is getting affected. Children are getting affected. And we are definitely seeing some degree of mortality because of probably a possible mutant strain. Of course, the government of India and government of Maharashtra is closely collaborating with the help of CSI and ICMR to find out if there are genomic mutants in each district, mapping every week, happening from this week itself, so that we'll really know if there is any association or no association. Having said that, I think we need to be cautious and careful, and it's a behavioral change issue, as Dr. Muliyil said. But Barkha, it's very difficult to change human behavior. And particularly this has happened in Brazil, it has happened in South Africa, it has happened in UK, it has happened in the United States. Indians behave in a very rebellious way. If they behave responsibly, I don't think we'll have this problem to do this.
But Dr. Joshi, we have election rallies with all of our netas where nobody and nothing is masked. So before we tell citizens to behave COVID appropriately, we have to tell our politicians to do that. And that's why I think many people find it hypocritical that we are being policed, we are being fined for not wearing a mask, even if we're alone in the car. And then we see all these images. Can we bring up these election images? I just want to show these images for a moment. You see all of these election rallies where there is actually no wearing of masks. I think we've all seen these pictures. And as we pull them up, Dr. Joshi, if you could talk a little bit about what you find is the particular difference between the last wave and this wave. And you also made a comment saying that the infrastructure is crumbling. Now, because I traveled extensively, including in Maharashtra through the last year, what happened to all the jumbo facilities that had been made for COVID management? What happened to them? Were they shut down? What happened to them? Why aren't they there? Why is the infrastructure crumbling?
So currently, if you ask me, all that infrastructure was kept as it is because we were anticipating the second wave. We anticipated it somewhere. No, they are all there. And therefore, clearly, but the neo-rich class is not willing to go to a public hospital. That is the challenge which is happening. Today, we have beds in Mumbai. We have beds in the ICU, but nobody wants to go to a KMJJ hospital, which has beds there. So if you see even today, the dashboard, there are sufficient beds in the state of Maharashtra and in the city of Mumbai. And the jumbo facilities are very much active. But as I said, there is a population shift from a lower socioeconomic strata to a middle class and upper socioeconomic strata. And that population wants to have a private bed. So that is the challenge which is occurring, and that is why there is a little bit of jeopardy. If you see actual numbers of beds, even today there are ICU beds as well as regular beds vacant in Mumbai city, despite of Mumbai crossing.
But instead of restricting, shouldn't the government be able to tell, any government be able to tell the middle class, the upper middle class and the wealthy, you got to take what you get? Just because they want private beds and private rooms, cities can't be shut, Dr. Joshi.
I think that city is not shut. City is functional for essential services. City is taking a mini break for breaking a chain of a virus, which is under restrictions. And I think if police infrastructure is not appropriate to do micro, see what is happening is we have a large pool of invisible suspect COVID and actual COVID patients, which are invisible in the population. Ideally, they should be micro-contained. That's the right public health approach. But micro-containment in a systematic fashion with a robust public health infrastructure and police system is unfortunately not present in various states of India. And if that was in place, and it's not easy to police. For example, if you want to micro-contain a society and there are more than 5 persons who are positive in that society, it is not easy to contain them. People still want to, rebel, move out. If they're asymptomatic, they feel nothing is happening. We saw film stars still going out for their shoots, and most of them have tested positive now. So, it's not just politicians we can blame. I think overall in society, people have been overall reckless and not been cautious and careful. If they had been cautious and careful, this would have not happened. But people thought COVID's over and it's just a mild disease and there is no deaths and it's all gone. And now we are probably dealing with a mutant strain and we are all stumped. So I think sometimes some of these strategies help. If we don't have the night curfews, for example, night curfews, all the statistics say that they don't work in other places. In Mumbai city, if you see on the weekends, all the restaurants are full. There is absolute overcrowding in various places. All the social gatherings are at peak. So, if you need to have a restrictive strategy to do some containment of some form for a couple of weeks, and when it is a hotspot, when the TPR of Mumbai drops down below 5%, I don't think anybody wants that restriction to be put. So I think this measure is a very extreme, drastic measure and ideally should not be done. I would also agree with that. Nobody wants to, and that word lockdown has become like a taboo. Even this mini lockdown has become like a taboo. So people actually, minute you hear the word lockdown, the first instance is to rebel or throw a stone. And I think that should go. I think it's important to recognize that this is a serious problem. We are being overwhelmed by a tsunami. And if this tsunami is not able to be contained in a micro-contained way, we can actually get into trouble. I wish and pray that we recover better. I wish and pray that the case fatality rate remains at 0.3, 0.5%, and that's ideal. Okay, and it just is like a mild flu and it goes away.
Yes,
but unfortunately, it's not.
Okay, let me get Dr. Muliyil to respond to some of the things you said, and then I have some more questions for you, Dr. Joshi. Dr. Muliyil, if you want to just respond to everything you've heard, we are overwhelmed. The growth is not arithmetic; it's geometric. The infrastructure is crumbling. The class of people has changed. People have got rebellious. Please go ahead, respond.
I agree with him fully. It is a different group of people who are getting infected, but they have a past history of being careful. In fact, they know how to do that. They have done it patiently. The thing is, how do we win them over? And I think that is the toughest part of this whole, enigma. And I'm being used to different population, very responsible population, very careless population, and I have a feeling that you have to create a movement. Now, remember one thing: the epidemic is sustained by the number of susceptible people. So, if when you ring in your palms in despair, you should also remember it itself, the epidemic itself will dig its own grave when the people get infected. In fact, what I'm trying to see is, on one hand, we are accelerating vaccination, and the other hand, infection is also improving the immunity. But the strategy must be to prevent death and serious outcome. I was so happy to hear Dr. Joshi saying there are no deaths for beds. It's just that people don't like to go to government facility. But at least that is something to, comforting to me. So we can reduce the bad outcomes with careful management. And I think that people are in Mumbai, or the administration is responding because they want to protect people. It is just that the attitude has changed, and I don't know how to do it. I'm an epidemiologist, not a behavioral scientist. So from the movie industry, you will be able to get people who will help you to solve that problem.
Yeah, but Dr. Muliyil, before I get Dr. Joshi in, what would be your personal prescription at this point? Because I want to play out for you. Now, Maharashtra, of course, has been asking for more vaccines, and they've been asking for the right to vaccinate everyone above 25 years of age. We also know that 60% of cases continue to come from Maharashtra, new cases. But when the government in Delhi was asked why, vaccination is not being universalized, at least in the top worst hit states, a very strange comment was made about how vaccines have to be first given to those who need it rather than those who want it. The fact is, at this moment, everybody needs a vaccine, many would argue. So let's just play out for you what the center said when asked about universalizing vaccines.
एक और नैरेटिव चलता है, अधिकांश मित्र उस बारे में विमर्श भी करते हैं, वो ये है कि आखिर हम वैक्सीनेशन को सबके लिए क्यों नहीं खोल देते, क्यों नहीं हर बालिग आदमी को टीका लगा दिया जाता। मैं आपको ये बताना चाहता हूं कि विश्व में क्या हो रहा है। उन लोगों ने भी बहुत विमर्श किया है, उन्होंने भी सोचा समझा है, उन्होंने भी विज्ञान को देखा है। जब भी आप इस प्रकार का टीकाकरण करते हैं किसी महामारी में, तो आपका मुख्य उद्देश्य ये होता है कि आप मृत्यु से बचें। हमने आपको दिखाया कि अन्य पाश्चात्य देशों में, इन द वेस्टर्न कंट्रीज, मोर डेवलप्ड कंट्रीज, the number of death is significantly higher than India. So the basic aim is to reduce death through vaccination. What is the other aim? The other aim is to protect your health care system. अगर आपके डॉक्टर ही ग्रसित हो गए बीमारी से, आपके नर्सेज ग्रसित हो गई, आपके पैरामेडिकल कर्मी ग्रसित हो गए, तो आपके अस्पताल में काम कौन करेगा, वो चलेंगे कैसे? तो यही दो उद्देश्य हैं, चाहे भारत हो, अमेरिका हो, यूके हो, कनाडा हो, कोई देश हो। इसके अलावा कोई उद्देश्य और नहीं हो सकता। जो सबसे वल्नरेबल हैं उनको आप कैसे बचाएं और अपनी स्वास्थ्य व्यवस्था को कैसे सुरक्षित रखें। उद्देश्य कभी यह नहीं होता कि जिसको चाहत है उसको टीका दिया जाए। उद्देश्य हमेशा यह होता है जिसको जरूरत है उसको टीका दिया जाए।
Hello.
This distinction that the government has made, Dr. Muliyil and Dr. Joshi, between want and need is a very specious distinction, because actually vaccines don't guarantee against infection. They offer protection against disease. In other words, you can still be COVID positive even after you get the vaccine, but hopefully, and the data shows you that more than 95% efficacy of all vaccines is against hospitalization. So if, as Dr. Joshi said, the health system is what's swamped, we need more vaccines. We don't want more vaccines. We need more vaccines. And yet this is the approach the government is taking. Secondly, Adar Poonawalla, in an interview to me just yesterday, actually raised questions about the vaccine supply. He very clearly said that at the current rate, India cannot vaccinate more than an average of 3 million a day. We've actually hit peaks of higher than this, including 4.3 million, but he's obviously talking about over a period of time. And he doesn't think these numbers will change till June, for which he says that the Serum Institute needs 3,000 crores. So on the one hand, you have a vaccine supply problem. On the other hand, we continue to take a pan-India approach to vaccinations instead of giving more vaccines to the worst hit states. I just want both of you to respond to this. Dr. Joshi, we'll start with you first on the vaccine issue. The fact is that actually people who are the working population may be more vulnerable today than the elderly who are staying at home if there were no lockdown.
This is a big challenge between equity and equanimity. And I think they want to have an equitable distribution of vaccines, but then decide a prioritization within equity, which is healthcare workers, vulnerable groups, etc. But that is true for general population when the pandemic is not so aggressive. If you have a hotspot cluster like say Mumbai, Nagpur or Pune, which is burning, and we have a large younger population being afflicted, which is a working class population, which is going to be economically unproductive, I think there is nothing wrong in asking for vaccination for that population, at least for those geographies. We are not asking that you go to the villages where the TPR rate is less than 5%, vaccinate them when it is available. I fully agree with that. But when the cities where you are seeing that they are overwhelmed, in a month and a half, we will be able to have a reasonable population with zero positivity rate. So I think it's nothing wrong in asking for vaccinations for the cities which have been badly afflicted. And I think that is a very pragmatic approach, which the Honorable CM tried to appeal to the central government. In their wisdom, they will do whatever is appropriate. But I think this is a very genuine concern because we are overwhelmed with this particular problem. And it is only for those geographies where the challenge is very high.
And Dr. Joshi, before I get Dr. Muliyil, are you running short of vaccines? We've seen multiple reports now of vaccine centers running short of vaccines. Earlier, we had the opposite problem. We had vaccine hesitancy. We were not seeing enough people show up at centers. Has the opposite started happening in Maharashtra now, Dr. Joshi?
Oh, yes. There are many centers where there are no vaccines or vaccine stocks are only available for a couple of days. But the central government has assured us that they will replenish them ASAP. So I hope
how short are you?
Maybe a couple of days. Even
so
in a city
on an average, how short are you?
So in a city like Mumbai, we are short, within 2 to 3 days, all the vaccine stocks would be replenished. Maybe depleted. And therefore, the central government has assured us that they will be replenished.
Okay. Dr. Muliyil, now you've seen the debate around vaccines, and we are still seeing the center run a very centralized, tightly controlled dispersal of vaccines. Doesn't the approach to vaccines need to change? For example, we know that there are about 6 states that account for 75% of all new cases. Why aren't we giving more vaccines to these 6 states?
Well, I suppose this kind of a dialogue should continue. But the key thing, Barkha, you said this earlier, the vaccines, unfortunately, don't reduce transmission significantly. It is not a bad thing. Remember that the vaccine is designed to prevent serious outcomes and death. That's the way we create the vaccine. And the mechanism of vaccine action is based on that. So if by a chance our vaccines are able to prevent transmission, that would have been a bonus. So the issue now is who are going to likely have a bad outcome. They need to be really protected first order. And again, our focus cannot be how many COVID positive. That doesn't make sense.
Exactly.
How many are in trouble. So that reduction of the seriously ill people or the people who are likely to die is best achieved by an approach that is going on now. So I think there is a both parts of it: anxiety, social pressure. But very happy to hear that in Mumbai, that vaccine acceptance is climbing, which is a good sign.
Dr. Muliyil, what would you prescribe as a way forward? Because I think one of the very important things you've said, and this leads me to many arguments with friends, is that to keep on focusing on how many are positive no longer makes sense. Yet every day the dashboard tells us we have hit the highest single day spike. And what happens is we forget to tell people that most people will recover from COVID. I'm not trying to make light of this, but most people will recover from COVID. What then ends up happening is fear, paranoia, and states feeling the pressure to impose lockdowns.
Anyway, one thing we should remember, there are certain assets India has. Now remember, there was a dichotomy in thinking. You are either for herd immunity or to waiting for vaccine. Now that is a dumb way to do things. This is not, President Trump versus President Biden. No, it is health. Both situation, natural infection and vaccine, induce exactly the same immunity, except that natural infection prevents reinfection better than infection after vaccination. So you should say, work together, infection and vaccination, both will make sure the problem ends. So if the mindset is clear, you will also figure out things in a very positive manner.
So what should the government be doing right now? And then I'll close with Dr. Joshi. What should the government be doing?
I think they should also set a little example in terms of, like, for example, use an election, no mask and things like that. I mean, this is not good because you can't have people.
Yeah, look at these shots. You can't tell people to do COVID appropriate behavior when you have all of these images, and they're all parties. It's not any one party. But go ahead. What would you advise the government to do?
No, I think we have to remember that India, the people of India has responded so far very well to COVID with an innately low mortality. And that is the biggest strength we have. We do have a large number of people already infected, and that is in our kitty already, and they are protected. Now, all we have to do is give some finishing touches with the vaccination, and the problem is solved. So have a positive outlook, and I'm sure we can overcome this crisis.
Dr. Joshi, I'll give you the last word because you're not feeling that calm right now sitting in the epicenter in Mumbai. I think what Dr. Muliyil is arguing is that those who've actually been infected already will be assets in a way. They have a kind of, even though vaccinations are advised even for them because we don't have enough science on reinfections, but reinfections are not the norm, at least. We know that. They're not the norm, they're the exceptions, right? Go ahead with your last thoughts, Dr. Joshi. What does Maharashtra, as the worst hit state in India, need right now above everything else? And why this 8 p.m. restriction, by the way, on even delivery boys of Zomato and Swiggy? I have to ask you that. Why not treat some of them as frontline workers who should get vaccinated, for example?
I completely agree with you. I think the BMC Commissioner has already issued a guideline that 24/7 deliveries will be made. I think that has got corrected. Today is the World Health Day, and I think we need to be proactive. I agree with Dr. Muliyil that we need to be resilient and sending some very powerful behavioral change messages. And if the leadership at large takes that, makes them citizens more responsible, masking becomes mandatory. I think we see the strongest vaccine, if you ask me, is not the real vaccine of the disease. I think it is a mask. And mask is 100% effective. I think there is no two ways about it. And if you are in a crowded environment, double mask. There is no two ways about it. And that data is absolute. I mean, there is a level A evidence for that data. Nobody can challenge that. Unfortunately, we forgot our basics. And I think it's time to rewire our basics. We don't want our second or third or fourth waves. We have set in some form of a fatigue with people and the people taking care of them as well as the administration. Everybody is COVID fatigue. And I think we can battle it, but I'm positive that we'll come around it in 2 to 4 weeks. We'll see numbers coming down. And I wish and pray that the rest of the country handles this equally well. And I think I'm optimistic that we'll have a larger herd immunity setting in the next 3 to 6 months or maybe a year down the line, and we can overcome this problem. I think it's something which we need to be very, very strong, positive, resilient India, because India has an ability to rise to the occasion. So I'm optimistic.
Yeah, well, glad to hear that optimism, but very important message you ended with. Personally, I would say, we need to vaccinate if we're eligible, if we can get the vaccine, but otherwise we need to mask up and live. I don't think this country can take another lockdown. I think that is where you will see more rebellion, Dr. Joshi, instead of less, even more rebellion than you've seen before. But we'll leave it there. It's a tough time for you in the hot seat, and Dr. Muliyil, your calming words are always very reassuring. So thank you to both of you. And we'll bring you back to evaluate the situation again in a couple of weeks. Thank you so much for educating us today, and take care and goodbye. Bye-bye. It's great to see you here. Thank you for watching our work. If you haven't subscribed yet, don't forget to click the bell icon and subscribe to Mojo Story and support independent, robust journalism.